When most parents sit down to dinner with their children, it's a normal meal, but for parents with children that have a swallowing disorder, they have to watch their child cough, choke, gag, and even sneeze during feedings. Now, locally, East Cooper Medical Center is offering a service to help these families with a new swallow study. Meredith Godbold joins us with all the details. Thank you for joining us today. Now, Meredith, I have a question for you, as being a parent and the parents who are out there watching this morning. How can you determine a normal gagging or choking reflex, say in feeding, if the food is flowing, too freely through the bottle and you have to stop because there's some gagging or choking? How can you differentiate that from something you should really be concerned about?
I think parents have intuition on when there's a problem, first and foremost. We all, adults and children alike, we all gag and cough at times when we eat and drink, but if this is something that's occurring frequently, and it's concerning and stands out, as well as the child has respiratory infections or congestion, you need to speak with your physician, your pediatrician about that concern. And of course, the physician's the one that would diagnose whether this is a significant problem or not.
Now, are there some symptoms that parents should be aware of? You mentioned maybe gagging or choking more than normal. Would there be a change in appetite? What are some of the symptoms that parents can look for in addition? We can start, of course, when a child is born, as a newborn, there can be subtle signs or overt signs. The overt ones would be gagging, coughing, choking, but there can be subtle signs such as just eyes tearing, or as you mentioned, the sneezing. Again, you need to take it to heart of how you feel and talk to your physician. Now, does that all have to do with how the food goes down the pipe, or something maybe is going the wrong way? Is that how it ends up with their gagging or choking or even sneezing?
Right. As our food enters our mouth and goes down our throat to our esophagus, it needs to stay away from our airway, which heads towards our lungs. So any of those symptoms are going to show that there's food or liquid possibly going into the airway, which is not normal.
No, it's not. Now, are some children more predisposed to having swallowing problems? Is it something that's hereditary, or how does that work?
Certainly, children who are born premature, there's a higher risk. Certain children that are born with certain diagnoses are as well. But children that are born, we think, that are typically healthy can also have these symptoms. Not as commonly, though. Right.
Now, have you seen a lot of cases with that? And we'll get to the study when we talk about that. Has there been a lot of cases being reported, and that's why you guys are going to be doing this study?
No, we just have the opportunity. We have hired on a pediatric speech pathologist who is specialized in pediatric swallowing disorders. So we have now the opportunity to expand our services. We have offered modified barium swallow studies for many years. We currently focus on adolescent and adults, but we just now have the opportunity to expand it.
Now, with this said, let's talk about that a little bit. East Cooper Medical Center conducting the new swallow study. Tell us more about that, the ages that parents can bring their children in, and do they have to have a recommendation from a doctor, or is it just something that they go on?
Right. This would be like any x-ray test. These tests are done in radiology, so you have to go to your doctor. Your doctor has to deem whether this is even warranted, and they would recommend it. They would write a prescription like they would for anything, then you would set your appointment. It's an outpatient test. We schedule them about an hour. The test takes less than 5 minutes. It's a very non-invasive test. They actually just eat and drink as we record them under video x-ray, and the parents are involved completely. So if it's a baby or an infant, we will use the bottle what they're used to. We will place what's barium contrast, which is an element that we will mix in with the food or liquid that we give them that allows us to see where it's going as they swallow.
Now, is there a cost involved with this? Do you have to report it to your insurance company, your health insurance company?
Right. It's a medical procedure, so your insurance would be what would pay for this, or you would go through your medical insurance.
So for the parents out there who are watching and they're getting this information and a light bulb suddenly goes off in their heads, like, hey, wait a minute, my child is experiencing some of these symptoms. What would be the next step after watching today's show that they should do in order to schedule an appointment? Do they go to their doctor first?
Right. Definitely talk to your pediatrician. They're the ones that would drive whether this is necessary, and then their office will most likely schedule this appointment for them.
All right, Meredith, thank you so much. We do hope that information was helpful for you today. Now, we have to take a quick break, but our Courtney Rochon previously caught up with Olympic medalist Dara Torres. She's got all the workout secrets for busy moms after the break.